Hello, and welcome to the first webinar for the Heart Healthy Connections presented by CRW Heart Healthy Families and Niamani Choices. My name is Crystal Glenn, and I am the project coordinator and media specialist for the Heart Healthy Families program, and I will be your host today. First of all, thank you so much for joining us. The reason why we started this uh, webinar is to bring about awareness and allow a platform for our partners for the work that we're doing in the community. So just a little bit of information about Heart Healthy Families and CRW. Heart Healthy Families is a signature wellness program, and we have several turnkey activities that we do that address issues around health. We also partner with faith-based and community-centric organizations that share a common goal in advocating for families to become more knowledgeable about heart-related diseases and other health risk factors. So Heart Healthy Families was a program that was developed by CRW and Associates, and we use it to promote healthcare awareness. And with that being said, just a little FYI, October is Health Literacy Month. So this is a great opportunity for us to kick off Health Literacy Month with the Heart Healthy Connections. All right. So our goal is to work with our partners, our program in the community to create heart healthy families. Um, and we do that through working with partners, through different outreach programs, and in the current climate, we're using digital platforms such as Zoom and Facebook to bring that information to the community. All right. So if you are out there and you would like to participate or you would like to partner with CRW and the Heart Healthy Families, there's several ways that you can do that. Um, there's a partnership, there's cooperation and collaboration. And really what that is a breakdown of how involved you are in the community. So if you are cooperating with Heart Healthy Families and CRW, you get involved for the short term. We participate in events like this, digital health conferences, health fairs, fitness fairs, educational forums, and health screenings. But if you're in it for the long haul, then you may be more likely to partner with us in a coordination level to work strategically to bring some healthcare solutions to the community and really make an impact, because that's what we're here to do. All right. So I will share this information again, but just as a very high level, we are located, our headquarters is in Lanham, Maryland. You can call us at our toll-free number, which is 1-800-515-7422 or 240-428-4543 if you're local. And you can send us an email at hhf@crwandassociatestoday.com or follow us on Heart Healthy Families on Facebook. All right. So that was just a brief overview of uh, CRW's Heart Healthy Families program, which is also in conjunction with Niamani Choices, which is a nonprofit arm for our organization. So there's a lot of different things that we're doing in the community. Even though CRW is a health consulting firm, we do outreach, and this is part of our outreach efforts to make sure that we're touching the community in as many ways as possible. So before I introduce our guest, I would like to introduce, and I'm putting him on the spot, our program director, Mr. Pastor Payne, who I would like him to just come on and say a few words and help introduce this program before I introduce our first guest, our guest for today, DC Health. So Pastor Payne, are you there?
Ma'am, did I unmute?
Yes, you are unmuted.
Okay, great, good. Good afternoon to everyone. Thank you for taking the time, because everyone is rushed for time nowadays, but taking the time to share in our efforts to get the information out to our respective communities. But more than getting information out, we want to act upon that information in a very noticeable sense of being there with the caller or being there with the questioner to find out the better ways to put out information as it relates to health management systems, and more importantly, the well-being of that individual. So very proud to be a part of this. We have a great team of experts. Looking forward to hearing what our first strategic partner, the Department of Health for the District of Columbia, Ms. Eisenberg and Ms. Baltimore, talking about what they're doing and just partnering with them. So thank you again, ma'am.
Absolutely. Thank you so much, Pastor Payne, for your guidance in this effort as we continue to not only disseminate information, but also bring helpful resources to the community that they can utilize. So our first, oh, and I would be remiss if I did not give a special thank you to our regional health coordinator, Cecil Doggett, who formed a partnership with DC Health to bring them to us today. So thank you, Cecil Doggett, for the work that you're doing here in the national capital area to help us expand our reach and connect with different partners. I would also like to acknowledge some of our other regional health coordinators that we have on the line. Ms. Olga Rodriguez, who is in San Antonio, Texas. Hi, Olga, how are you? And then I would also like to acknowledge Reverend Malone, who may not be joining us today because he is doing a lot of outreach in the Georgia region. So as you can see, the Heart Healthy Families is not just a local campaign, a local organization, but we are national. But we are starting here in our backyard. So without further ado, I would like to present to you, introduce to you, Ms. Joni Eisenberg and Ms. LaShawn Baltimore. Welcome, ladies, and thank you for being here with us today.
Thank you
for having us.
Thank you, thank you. So before we get into your presentation, if you could just tell us how you are connected to Heart Healthy Families, like your relationship with Cecil Doggett.
Well, let me answer that one. I've been blessed to know Cecil for decades when he used to be with the Health Services with Children with Special Needs. And over the years, we collaborated through the health department on all kinds of things. So when I knew that he moved into a new role, it was 2.5 years ago, we started talking about this special initiative that we're going to talk about now. And the rest is history. So I'm thankful to be working with Cecil again.
Wonderful, thank you so much. So that just lets you know that the work that we're doing in the community is spanning over time, and these are relationships that have been cultivated over the years. So thank you, Cecil, for introducing Joni and LaShawn and DC Health to Heart Healthy Families. So
and let me just add, I've worked with Pastor Payne as well, wearing different hats. So we're family here.
Yes, everybody's worked with Pastor Payne. Everybody has worked. So without further ado, Ms. Joni Eisenberg and LaShawn Baltimore, I'm going to turn it over to you. Everyone, I hope you enjoy, and I look forward to the information that is about to be shared from these two ladies in regards to living well. And it ties greatly into the work that we're doing with Heart Healthy Families. And once their presentation is over, we'll do exactly what this forum is designed to do, which is make the connection to resources and how to continue to better educate yourselves and as a community. So without further ado, LaShawn and Joni, it's over to you.
Good afternoon, everyone, and thank you all for attending this meeting. So today we will be discussing our Living Well Self-Management workshops for chronic health conditions and cancer. So we will give we will provide an overview of our evidence-based living well self-management workshops. We will discuss the benefits of the workshops, and we will explain how the workshops are being conducted during this unprecedented time of COVID. And then we'll explore and define some next steps for potential workshops and collaboration. So again, my name is LaShawn Baltimore. My main role with DC Health is community relations. However, I play a major role in the coordination of our Living Well workshops. Joni, would you like to introduce yourself?
Yeah. And my name is Joni Eisenberg, and I'm also with DC Health for many years. I'm a public health analyst, and LaShawn and I work together with our team to coordinate these workshops for the community. And later on, somewhere in the presentation, we'll talk about a health initiative, a heart health initiative that we have in the health department.
So DC Health offers workshops that we hold the license to the workshops through Self-Management Resources, which is formerly known as Stanford University. And the workshops that we offer are the Chronic Disease Self-Management Program, the Diabetes Self-Management Program, and the Cancer Thriving and Surviving Self-Management Program. We do have a video. I'm not sure if the audio will work, but if you click on it, see if it will start.
Better Living is a workshop for our union members
with chronic conditions.
Of diabetes.
Diabetes been in my family is a big issue.
I have high blood pressure.
The condition is chronic ulcer.
High cholesterol.
I have high blood pressure.
I have some high cholesterol warning signs that are going off, and it's something I should be aware of.
In Better Living, members of our union learn how to take care of these conditions through exercise, nutrition, and stress management.
To join in Better Living, I realized that there's other things that I can do to control my blood pressure, as far as eating right, exercising, and using tools that can help me.
You need to have the tools, and Better Living gave you the tools how to help you manage your health.
In Better Living, union members learn to set up their nutrition and exercise goals.
The goals I set in Better Living was to do exercise.
Exercising 30 minutes a day, and just that little time has changed how I feel.
Sometimes I had to push myself, but it was not easy. But once I finished exercising, I felt so good.
Every morning when I go to work, I walk.
I bought a jump rope. You don't need a lot of space for that. You don't need a lot of equipment. You know, $15 and a jump rope and this much space, you can do a lot.
So my goal was I start dancing, doing exercise for 20 minutes each 3 days. And I took my wife, Herman, and we dancing, you know, that's more easy. Everybody know I'm Dominican, so we were dancing bachata and merengue.
Eating right is a big part of Better Living.
Our goal is to cut sugar, to cut fat, and to eat better food.
We learn about the portion we had to eat.
Grilled and roasted vegetables are much better than fried foods.
Everything I have to buy now, I have to look at the label. How many sugar, how many calories, because when you're father, you buy things for your kid, you have to make sure you buy the right thing for them to eat.
Working in food service, you're surrounded by a lot of different sweets and sodas and sugary drinks.
I love sugary beverages. I'm going to say that on camera. I love the sweets.
I would drink Sprite, ginger ale. I realized that that was a lot of sugar that I was consuming.
I wanted to drink more water. They helped me set up a schedule so that it was very easy to follow and help me meet my goals.
I've decided to drink seltzer water more, drink water.
My daughter loves bread. What I do, she loves white bread. Now I change white bread to all week bread.
My wife cooked very, very nice. When I go home, oh my God, I was eating everything. I say, I'm going to eat just one time right and less portion.
A lot of chronic conditions are affected by stress. Better Living teaches meditation and stress relief.
I learned in the workshop at Better Living is meditation. I learned how to meditate.
When the instructor told us to close our eyes, and I closed my eyes, and I listened to the tape, I felt so relaxed and so calm and so peaceful. I was like, wow, that was very good. Because I am so busy at work. When I go home, I have to do my chores, and sometimes I cannot sleep. And meditation helped me to relax. Once I do the meditation, I feel calm, peaceful, relaxed. I'm able to focus at work. I am energized at work, and I'm able to think and get through my day.
Better Living works because union members get support from each other to reach their goals.
I was able to do it with my co-workers.
As a team, we motivate each other.
We all work together.
I have new brothers, new friends, new people coming to help me up in my life.
It's like being like a baseball team. We all had the same goals and we're all pushing towards the same direction. So if I am faltering or if I'm slowing down, there's other people there that are going to help me, pick up that slack and remind me to stay on target.
Members who do Better Living have a big changes on their life.
Quinoa. I never tried quinoa in my life. Now I eat quinoa. Maybe next will be tofu.
Now my family eats better.
It was like someone turned the power back on, like someone plugged me in.
I feel better. I feel like a new person.
I lost 10 pounds in 6 weeks in the program.
A couple of my coworkers are saying, oh, I can see it in your face and I can see it in your body. What's going on? Are you taking pills? I'm like, no, I'm doing Better Living now.
Better Living is critical because when we take care of ourselves, we don't have to pay for those expensive hospital or emergency room visits. This protects our insurance fund that we fought and negotiated for.
Everyone knows when it comes to negotiating contracts, healthcare is always the biggest issue. That's always the biggest fight we have, is getting our benefits taken care of.
When we are feeling better, we don't have to go to the emergency room, hospital.
If you don't go emergency room, that means you will spend less money. That means more money will still stay in your pocket.
Better Living is here for you, and it's free.
Your health matters. Don't say it doesn't matter. It does matter.
In our union, we have a saying. It says, if I get the...
Okay, so that was a few participants giving their testimonies, discussing the benefits of the self-management workshops.
Do I jump in, LaShawn?
Sure.
Just to give you some of the basics of the class, each session is led by trained community peer leaders that include leaders with a chronic health condition. And most of the peer leaders are from, or all of them are from the DC area. The intended audience for the workshops are DC residents, people who work in DC, and caregivers for residents or workers. The workshops require that the participants be over the age of 18 with a chronic health condition. And in DC Health, we prioritize the communities with the high rates of chronic conditions, which are wards 5, 7, and 8. And we're going to be talking about the new way that we do these workshops during the time of COVID. We're going to explain a little bit about what chronic conditions mean, and we might take a moment to get some questions from you. A chronic condition is different than a chronic disease. So these workshops are not focused just on diseases. They're focused on conditions that are maybe last 3 months or more, but they're not a disease necessarily. So some examples are if you're overweight, if you have pre-diabetes, hypertension, anxiety, depression, insomnia, asthma, chronic pain, and if you smoke cigarettes, we consider that a chronic condition. If you overuse alcohol or other drugs, that's a chronic condition. So and we're going to discuss this more, but did anybody have any questions about what a chronic condition means? Or if anyone wanted to share a chronic condition that they have, we're going to discuss how it's really impacts us during this time of COVID. People tend to be more anxious, etc. But are there any questions now about what a chronic condition is?
No, I think not at this time, Joni.
Okay.
So you can keep going and then
We'll keep going.
Yeah.
So some of the topics that we cover in these workshops is making an action plan. That is one of the most important things that we do. It's to teach people the skills to self-manage their own situations. So making an action plan is a priority. There's also relaxation is included. Problem solving is another big topic, dealing with anger and fear. We do some fitness work in the workshops. We discuss how to breathe better, how to deal with fatigue, nutrition, communicating with your family, your friends, your health providers, dealing with medications, making decisions about how you want to address certain problems you have. Depression, brainstorming is another major thing that we do in the workshops. Some of the keys to the success is the workshops give you skills to handle your challenges. We want to emphasize this is not a drop-in support group. So we ask that participants make a commitment to stick with us for 6 or 7 weeks of the hourly or the weekly sessions. Participants choose their own goals. It's very, very interactive. And this curriculum has been tested for over 25 years. And I can testify that it actually is very interactive, and community folks really love these classes. The leaders offer guidance, but the participants really work together to find solutions to their situations. During these days of COVID, we do things a little differently. We have 2 basic different kinds of choices that you can make to select an approach. One is what we call phone sessions. This is simply on the telephone. We can have up to 6 people for 1 hour weekly sessions for 6 weeks. Each participant gets sent a really great toolkit, which includes a book, exercise guides, a relaxation CD, and an exercise CD, and some other stuff. So everybody gets this toolkit. We can also offer the workshops online, which we call virtual, which is on the computer through Zoom or other kind of platform. And with those workshops, we can have up to 12 participants, and you also get sent much of the same material. And then outside of the COVID time, we have in-person workshops for 7 weeks. But all of those in-person workshops are on hold right now. The results are measurable. There's been research on these classes. People have improved confidence. They feel healthier and have better quality of life, fewer sick days or fewer days of being depressed, have a better ability to manage symptoms such as fatigue, pain, shortness of breath, stress, depression, sleep problems. A lot of people increase the time that they're physically active. They could improve their ability to communicate with doctors, their health plan, family and friends, and increase ability to make decisions.
So this is a snapshot of some of the self-management workshops that were hosted in 2019. So we had several in Ward 5, 6, 7, and 8. And Ward 8 is really a priority in that they have the highest prevalence of chronic conditions in the city. And these are some more quotes from actual participants. Gloria from Washington, D.C. says, "This class is amazing. I learned how to manage stress, my disease, and how to live well." Then we have one from Janice, who stated, "You need to offer these classes more often. It is very needed. Bring it to the southeast area of the city. Do more outreach programs to reach more seniors and also the youth. Please come back soon to my center." So these are the DC Health responsibilities. So as DC Health, we are to target communities which have the highest prevalence of chronic conditions. We develop the strategies and try to sustain partnerships, conduct the outreach, and identify new partners and participants. We assist with program costs and ongoing evaluation. We recruit and assign peer leaders, and we provide oversight and support to them as needed. We provide sponsor organizations with guidance and resources to implement the workshops. We collect the data on participants with assistance from our partners and our peer leaders. And we continue ongoing communication with the peer leaders and our partners throughout the workshops. So the Living World Workshop host responsibility is to assess interest and capacity to host the workshops with appropriate delivery modes, discuss potential workshops with DC Health, including roles and responsibilities, promote the Living Well workshops, coordinate logistics for delivery mode, date and time, and location. When workshops are in person, which they are actually on hold at this time, we provide appropriate meeting space, recruit class participants, record required information to register people for class, assist peer leaders in following up with participants who are in attendance of the ongoing classes, and continue to communicate with DC Health and peer leaders throughout the workshops.
So during this time of COVID, we're finding that it's more critical than ever for people to learn and use skills that can prevent or manage chronic health conditions. Workshops can help us learn skills to self-manage new stresses that we're experiencing during this time of COVID, such as anxiety, isolation, loss, grief, financial challenges, unemployment. Some folks are having trouble coming up with their rent. Others are having new challenges with children home due to school closures. So we're finding that it's really more important to encourage people to take these self-management classes because they can actually help save lives. And of course, anybody with an existing chronic condition is more at risk for COVID right now. So obviously, if this class helps people to manage their chronic condition, it's going to also serve as some protection with COVID. So this just goes over in detail the different delivery modes we have. So we'd like to spend the rest of the time discussing next steps, potential workshops or ways to collaborate with you. If you have any questions, ideas for sponsoring or promoting workshops this fall, going over the differences between our two different kinds of classes, the phone sessions or the ones on the computer. Maybe we could talk a little bit about who you think you might like to offer the workshops to, etc. So again, we really hope we can collaborate with you with some next steps. And again, with the phone sessions, you only need 4 people to be on the phone session. So we're going to call on people like Pastor Payne to see if some of his church people might want to do a phone session, for example.
Well, we gladly will do that, Miss Eisenberg. I know you're going to say that anyway, so I'm going to step up to the plate now. So after the call, we'll follow up. Miss Baltimore, she definitely had pressed me about it. Not so much pressed negatively, but encouraged, strongly encouraged. And we need to do that. And the one question I have very quickly, ma'am, would you please let everyone know there's no cost for these sessions, at least if I'm correct on that, so that people do not think that a person has to have money in order to attend. And I want to make sure that that's put out there and, go DC. I'm listening to you, ma'am.
Yes, I thought we had that in there, but you're right. You're absolutely right. These classes are 100% free to the participants. So it's a really good opportunity. Like we said, especially right now.
Yes, ma'am. Yes, ma'am. And I think back to the point about Miss Baltimore, she was pushing, for a decision. We need to act upon it because, as you pointed out, because of COVID now, a lot of people are home. There may be people impacted, as we mentioned, from a socioeconomic status, financially, all kinds of things. And I think this would be a great way, at least a great outlet for something that a person could anticipate, expecting. I do appreciate the testimonies that you've shared with us. And of course, when I met with you and your team there in DC, it was just wonderful. So thank you.
Thank you.
Thank you.
Yes, ma'am.
Yeah, hi, Joni.
There's Cecil. Is that Cecil?
Yes, I finally figured it out. I'm on a different line now.
Okay. Well,
Yeah.
so Cecil, thank you for joining us. Real quick, thank you, Joni and LaShawn, for the presentation. And we will definitely, we will continue this conversation because a lot of the content that you shared was very valuable. And like Pastor Payne said, we can collaborate on, figure out some ways that we can kind of work together to better serve the community. On the screen now, you will see the contact information for the DC Health Chronic Disease Division team. So you have Ms. LaShawn Baltimore, whose information is here, and Joni Eisenberg, as well as 3 other individuals. So make sure that you get this. And if you would like a copy of this presentation, feel free to send an email to hhf@crwassociatestoday.com, and I can get a copy of that over to you. I believe we can share that with the public. Is that right, Joni?
Sure. And let me just add, we didn't include it in the presentation, but we have another initiative in DC Health called 1 Million Hearts. And it's a national initiative that's linked with the CDC. And we have our local 1 Million Hearts initiative that meets monthly. And the focus in our Million Hearts is to bring together people who work at clinics and health systems to look at how to reduce hypertension and cholesterol. So it's kind of based on system change, but that's something some of you may want to join that group as well.
Well, thank you for sharing that. And so I want to bring on real quick.
Crystal, I'm sorry, can I mention one more thing?
Yeah, sure.
We also provide participants with incentives. We have, so those that take the phone script workshops, we provide them with 2 $5 gift cards, one after the first class and then the second one after the last class. And for those participants who participate in the 6-week virtual workshops, we provide 6 $5 gift cards after each of the 6 sessions.
Okay.
Oh, great.
That is good. So Cecil, you are finally joining us. Did you want to say a few words to everyone before we break out to discussion?
Yes. Yes. First, I'd like to thank Joni and LaShawn for doing today's presentation, and wanted to just thank everyone for attending today's CRW Heart Healthy Family Partners presentation. And Joni, you asked earlier about some other collaborations. I think there's a few that we can talk about later that would definitely be interested in partnering with you.
Good.
Wonderful. Thank you, Cecil. I'm glad you were able to join us and that we were able to hear your voice. So real quick, before we move forward into some of the discussion, I would like to announce that it is currently open enrollment season. We would be remiss if we did not speak about that. It is also, October is Health Literacy Month. So this is a great opportunity to, again, educate some people. And I'm very excited to continue the conversation about the program, because October being Health Literacy Month, this program is a great way for people to learn how to manage their self. But before we go further, I would like to do a short commercial about in regards to the flu, and so we can make sure that we're protecting ourselves, and then we're going to continue our conversation with Ms. Joni and LaShawn and talking about the chronic diseases. All right, so hold on one second.
Important message from Medicare.
Hey, sweetheart.
Hey, Dad. How was your day?
Just got back from getting my flu shot.
Good call. You know the flu can get you very sick, sometimes with serious complications.
Especially for people my age. My buddy Ray was down for weeks with the flu.
Yeah, it's extra important that you protect yourself this year so you don't spread the flu to people.
Plus, my shot was covered by Medicare.
Oh, way to go, Dad.
Paid for by the U.S. Department of Health and Human Services.
Message from that Medicare. Was cute. That was really cute.
Hey,
oh, sorry about that. Hold on one
Get
second.
my flu shot tomorrow. It's covered by Medicare.
Good call. The flu can get you really sick.
Especially at my age.
Dad.
Paid for by the
Yes, sorry about that. So that was just a brief reminder to go ahead and get your flu shots. It is covered by Medicare and Medicaid. Because this is, I'm stating that because this broadcast pretty much goes across the nation in our different areas that we serve. So if you need more information or resources about Medicare or Medicaid, I would encourage you to visit the websites. They currently have the Medicare.gov site that you can go to and check out. And information about open enrollment, which started October 15th and will end December 7th. So you still have time for that. And then there's also the Medicaid.gov site, which is a fairly new site that the government has launched that will drill down to different states for that state level information on Medicaid and CHIP and other basic health programs. So again, doing our part and making sure that people are educated and know where to go for resources. That's what health literacy is about, and that's what we're doing today. So Joni and LaShawn, I do have a few questions because you guys brought up things about mental health in this. Yeah. So how important has the mental health aspect been in these programs? Because there has been a lot of talk about mental health as it relates to all of other chronic diseases. How important is the mental health aspect in this particular program?
I would say that it's very important and very much addressed because it's self-management and it's very interactive. People share the challenges they're having, and often it's related to mental health issues. So we don't necessarily segregate out mental health, it's integrated into everything we do. And that's one reason, among others, why we really want to promote these classes during COVID, because mental health issues are even more of an issue now during COVID. LaShawn, would you want to add anything?
No, I agree. Especially with, a lot of people being isolated now, it can cause a lot of stress and depression and other mental health issues. So I do believe that it is very important for people to get the information as it relates to their mental health and physical health. And I think, these workshops offer that to the participants.
Okay, so is it only open to DC residents? Because I think that that may be a question that people may have, and if it's only open to DC residents, do you know that of other regions that have similar programs?
This is a national program. We can get you the national email address. We know that there are several in Maryland, Virginia, as well as all over the country, but we don't know those off the top of our heads at this point. So we can share that national address with you, or if you wanted to ask the national folks for specific areas, they can get that information to you.
Okay. Okay.
I know there are quite a number of Maryland Living Well programs and Northern Virginia.
That is a good to know. So there are Living Well programs across the country. That is
yes, and they're actually called different things. Self-Management Resource Center is the national umbrella organization. So some call it Living Well, some call it Better Health, but there's an overall umbrella group you can contact.
Okay. And as I stated, October is Health Literacy Month. And one of the things that we like to educate people on, and something that you mentioned in the presentation, was about knowing your numbers and the issues surrounding like diabetes and the management of that care. How technical do you guys get with that support with the group, or how, what's the intensity level? I'm guessing.
Well, I can answer that, then LaShawn can jump in. The class does not focus on a lot of, I would call it, I have to call it technical details, but we encourage people to learn on their own what their numbers may be. And I don't remember, LaShawn, if we, I don't think we do any testing of blood pressure during the classes. Some classes have been in collaboration with a health center. And so occasionally they bring in a nurse that can help with that when we have the in-person classes. But the focus is to teach people how to get the information and to do it themselves. Would you say anything else on that, LaShawn?
No, I agree. I think it's just a matter of teaching self-management skills for them to be able to manage their own chronic conditions. And as Joni stated, sometimes we coordinate workshops with MedStar, and then they may have someone come in to take blood pressure or other numbers dealing with different chronic conditions. But as DC Health staff, we do not record any of that information.
Okay. So I have a question about collaborating and working with different organizations and forming these groups. So, because we work with a lot of we have different partners as well. Would it be something where maybe organizations have a group of people and they would reach out to create one of these groups? How does that process work?
Yeah, so especially if they're district residents, if it's outside of DC, we would give you the information.
Yeah, but in the district.
In the district, yeah. So that's exactly why we're excited to talk with you today. So if you or any of your partners would say, hey, we would like to consider a class, and here are our options. What do you think about us doing it with this group, or with this organization. And then we would be happy to kind of brainstorm with you or discuss how it would work. And especially the phone sessions are much easier now and require fewer people. But even the virtual, even getting, because the in-person, we usually like to have 15 or 20, but the computer classes just requires up to 12. So it's easier to do.
Yeah, I think the most difficult part for the host site would be recruitment. So that has been like the #1 challenge, making sure you recruit enough participants. A lot of times you have participants that say, yes, I will attend, but then when it comes time to actually participate in the workshop, it's either difficult to reach them or, you know, they just don't show up.
Okay, are there like mitigation efforts for that, or is it strictly like the honor code? This is your commitment. If you don't stick to your commitment, it's kind of on you.
Yeah, it's basically on them. It's not like they're mandated to do it or anything like that. It's a program for them, and if they're interested, it's here for them.
Okay, and that's where the incentives come into play.
But we try to talk through with a potential host to see if they're really interested and capable of doing it. We found that certain organizations are a better fit. So for example, we have in DC, we have senior wellness centers, and those usually work out pretty well because the centers know the seniors very well, and they can say, well, Louise will want to do this, but you know, they'll be able to recruit people. With organizations that have more of an arm's length and don't know the people, then they would have to use other means to really recruit. We do have flyers, but we find that usually one-on-one recruitment for this kind of program works best.
That is wonderful. I'm really excited about this program, and like Pastor Payne said, I know that there's some ideas that we have, and hopefully some of the partners that we have on the line or who will be listening to this at a later time will also have some ideas on how they can utilize this program in their communities, especially in the DC area. Is there anyone on the line who has a question for Joni or LaShawn? We have about 5 more minutes before we wrap up. So if you have any questions, feel free to unmute yourself. Speak now or forever hold your peace. Okay. Well,
I'd just like to add that if people do know someone, let's say, for example, I'm going to say Cecil. Cecil might think of somebody that he knows, and it may not be an organization, but he may know 1 or 2 people that he'd like to recommend to us. So that would be another way of getting people involved.
So groups of people.
Joni, you always put me on the spot.
I just mentioned you.
I actually do. We can talk offline, but I actually have a great connection in DC for you.
Good. I see. I knew you did.
That's exactly what this is for. I would like to thank LaShawn and Joni for being a part of our debut webinar for the Heart Healthy Connections. You guys provided a lot of great information, and this is exactly what this platform is geared to do, which is to share information in ways of how we can connect resources to the community. And what better way than to help them and equip them and empower them with the skills that they need to take care of themselves. So thank you for the services that you guys are doing in the community. Thank you to the DC Department of Health. And thank you, Cecil, for bringing these ladies to me. And I enjoy speaking with you guys, and I look forward to much more. So before we go, I would like to share some contact information to make sure that you can stay in contact with myself and the Heart Healthy Families program, as well as Joni and LaShawn. So again, Sorry about that. So again, here's the contact information for the DC Health Chronic Disease Division team. LaShawn Baltimore, you can send her an email at lashawn.baltimore@dc.gov. Phone number is 202-834-6336. Or you can reach Joni Eisenberg at Joni, which is JONI Eisenberg, EISENBERG @dc.gov, or you can reach her at 202-361-1688 if you or an organization or a group of people would like to formulate a group in the district. If you know resources, then definitely reach out to them. Thank you again, ladies, for that presentation. And if you would like to get in touch with CRW and Heart Healthy Families,
in 2 minutes, okay?
you can, you can reach us at, you can follow us on Facebook at Heart Healthy Families, or you can send us, and you can visit our website, which is www.crwsssociatestoday.com/heart-healthy-families, or you can call us at our 1-800 number, which is toll free at 1-800-515-7422. This is a typo. The email address is actually hhf@crwassociatestoday.com. You can send us an email there if you have any questions, or if you would like to partner with Heart Healthy Families, or if you would like to be the next featured partner on our webinar. This will be a monthly series, so look for it again in November. I would like to thank everybody again for joining us. This was presented by Heart Healthy Families, CRW and Associates, and Niamani Choices. Again, my name is Crystal Glenn, and I would like to thank you and have a great day. This concludes the Heart Healthy Connections.
Thank you.
So,
Thank you.
thank you,
Thank
ladies.
you, everybody.
All right, thank you.
Have a good day.
Bye.
You're welcome. Bye-bye. This will be, this was recorded and it did stream live, so we will be able to repackage it and rebroadcast it for you all.
Thanks, Crystal.
You're welcome.
Bye-bye.
Bye-bye. Thank you.